Ms. Shagufta Nahid, Dr. Mohammad Ali, Dr. Ephraim Shiraz, Tahira Shafiq, Salman Ahmed, and Salim Masih. We have topic to discuss on this session is complications in cath lab and radiation protection. The risk of complication during procedure may have significant effect on patient survival and health care. And what are the complications would be there? I'd like to call Ms. Maryam Sagheer to present his presentation. Ms. Maryam Sagheer is present here.
Assalamu alaikum. My name is Maryam Sagheer and I am from Punjab Institute of Cardiology. Today my topic is procedural complications, in which we discuss no reflow, perforation, dissection, entrapment devices, and pericardiocentesis. How can a nurse help in these complications? A 52-year male smoker presented with inferior wall MI and primary PCI was planned. After radial access, the guide was engaged into the RCA. This was the first RCA injection. The wire was placed into the PDA, and after balloon dilatation, this was the second view. In the third view, we can see that the stent is deployed and stent is placed into the proximal RCA and deployed in the fourth view. But after the deployment of stent, there is no flow in the distal RCA. If we go back and look into the second image, you can see there is a good flow into the PDA and PLV. Then what has happened at this situation? The best terminology which is used for this situation is abrupt vessel closure. Abrupt vessel closure is loss of TIMI flow within 5 mm of site of lesion while doing coronary intervention, where there was TIMI flow 3 before the PCI and TIMI flow 1 or 0 after the PCI. Causes of abrupt vessel closure is no free flow, edge dissection, vasospasm, embolism, and thrombus. The topic under discussion in my topic are the no reflow and edge dissection. As I started from the no reflow, we continue the no reflow. No reflow is inadequate myocardial perfusion through a given segment of the coronary circulation without angiographic evidence of mechanical vessel obstruction. We can manage no reflow through pharmacological measures and interventional measures. Through pharmacological measures, we can use different drugs like adenosine, nitroprusside, rapamyl, nitroglycerin, and adrenaline through guide catheter. There is a basic and major role of a nursing, which is these drugs should be ready for administration, decrease door to balloon time, and clopidogrel loading plus aspirin. Optimize heparin plus administration of GP2B3A inhibitors. Interventional measures for treating no reflow depends upon the vessel lesion and equipment, use of export catheter, rapidly flush saline via guide catheter, and use of distal protection devices recommended in saphenous vein grafting intervention. And here is the final view of our case after the pharmacological measures. There is a good flow into the PDA and PLV, which is called TIMI3. The second complication is perforation. Evidence of extravasation of dye or blood from the coronary artery during interventional procedure. There are different types of perforation. Type A is sorry, I want to take a pen. पेन मैं हाइलाइटर यूज़ करना चाहती हूँ. पॉइंटर है, यूज़ नहीं हो रहा. लेज़र पॉइंटर. Okay. There are different types of perforation. Type 1 is extraluminal crater without linear extravasation, and type 2 is pericardial or myocardial blush, and type 3 is clear contrast extravasation into the pericardium. Type 4 is perforation with spillage of contrast. The causes of perforation are due to enlarged diameter and high pressure, distal migration of guide wire, traumatic injury, or and ventricular wall rupture. Management of perforation is type 1 and type 2 is benign and easy to manage, but type 3 needs emergency measures. We will discuss in detail the management of type 3 perforation. Emergency balloon tamponade, deployment of covered stent and pericardiocentesis. We will discuss pericardiocentesis in the last of our topic. At this step, this is the nursing role and the management of type 3 perforation. Maintain airway breathing circulation, availability of covered stent, keep pericardiocentesis tray ready, cross-match the blood, normal saline bolus, check ACT and get protamine ready, get echo machine ready, and inform theatre as advised by the operator. Dissection is the disruption in the integrity of layers of arterial wall. If we look into the image, we can see the intima, media, and adventitia, the true lumen, and in the second part, we can see the collection of blood into the false lumen, and in the third part, we can see the intimal tear and accumulation of blood and flow into the false lumen. There are different types of dissection. Type A is luminal haziness, and type 2 is linear dissection, type 3 extraluminal contrast staining, and type 4 is also called spiral dissection. Type E is dissection with persistent filling in the coronary lumen, and type F is dissection with total occlusion of the coronary lumen. The nursing management in the dissection is the keep the appropriate size stent ready for deployment. The fourth complication is entrapment devices. It's a potentially life-threatening complication, inability to remove equipment from the body during percutaneous intervention. There are different types of entrapment of devices. Management of coronary equipment failure for the interventionist is don't lose wire position, understand mechanism of failure, consider properties of device and location of failure, and maintain therapeutic ACT. This is the management chart for entrapment and fracture for the primary operator. We will discuss the nursing role, have a basic knowledge and identification of various devices like snare and guideliners. Keep these equipment immediately available in case of such complication as demanded by the operator. Pericardiocentesis is a procedure which is done to remove the fluid that has built up in the pericardium. This is the picture of procedure in which we can see there is different entry points of needle insertion, subxiphidial, apical, parasternal, and dorsal. All the procedures have some risk, but the complication may we can lighten the complication by preventing the cross infection or maintaining the meticulous environment. In this procedure, maybe there is a risk of needle puncture into the lung or heart, or bleeding, infection, and dysrhythmia. The nursing management of pericardiocentesis is keep pericardiocentesis tray ready with all equipment, maintain a meticulous environment from the prevention of infection, cross-match blood, normal saline blood, check ACT and get protamine ready, get echo machine ready, inform the theatre as advised by the operator. Thank you so much.